For so many people, an inhaler is an absolute lifeline. But with all the different types out there, how do you really know you have the right one? It turns out it's not just about the medicine inside. So today, we're going to break down how that perfect match is made between you, your breath, and your device.
It's a fair question, right? You see them in all these different shapes and sizes, and you have to wonder why. Well, the reason is way more than just what kind of medicine is in them. The device itself, it's a critical piece of the treatment puzzle.
And that right there, that's the core idea. See, the goal isn't to find the single best inhaler on the market, because it doesn't exist. It's all about finding the best inhaler for you. It's a really personalized match between your own physical abilities, your unique breathing style, and the medicine your lungs need.
So, how do doctors even begin to make that choice? Well, it really boils down to two fundamental factors that go way beyond just the name of the drug on the label. Think of it like two sides of the same coin. On one side, you have your body, your unique abilities, things like how strong your breath is and how well you can coordinate pressing a button and breathing in. Then, on the other side, you have the physics of the medicine itself. How big are the particles, and where exactly do they need to land in your lungs? The perfect choice is right where those two things meet. All right, so to really get this, we've got to meet the three main families of inhalers. You've probably seen these acronyms kicking around before: PMDI, DPI, and SMI. Let's get to know them. At the most basic level, they work in two totally different ways. Some, like that classic puffer you're probably picturing, the PMDI, they use a propellant to actively push the medicine out in a spray. But others, the dry powder inhalers or DPIs, they're totally passive. They rely on the power of your own breath to pull the medicine out. And this one simple difference, it has huge implications for who can use which device effectively.
Okay, let's break this down. For the PMDI, the classic metered dose inhaler, you need a slow, deep breath. But here's the catch. You've got to time that press perfectly with your inhale. Now with the DPI, you are the engine. It needs a quick, forceful breath to actually get that powder out. And then you've got the SMI, the soft mist inhaler. It uses a spring to create this really slow-moving cloud, which makes it much more forgiving if your coordination isn't spot on.
And this gets right to the heart of why all of this matters so much. When a treatment isn't working, it's often not the medicine's fault. It's a mismatch between the device and what the patient can actually do, or just a simple mistake in technique. So here's the big takeaway. Having the right device and using it with the right technique is just as important as having the right drug.
So, if some of these devices are breath-powered, that begs the question, how do we know if someone's breath is actually powerful enough? Well, that's where this really cool concept called peak inspiratory flow comes into play. You can think of PIF as your personal horsepower for inhaling. It's not just about having good lungs in general. It's about the very specific measurement of how fast you can pull air through the resistance of a particular inhaler. And this is absolutely critical for those dry powder inhalers.
Right. You can't just guess at something like this. You have to measure it objectively. And thankfully, there's a really simple tool that lets doctors do just that, right there in the clinic. It's a really straightforward process. The clinician takes this device called an in-check and sets a dial on it to match the resistance of the exact DPI they're thinking about prescribing. Then, the patient just takes a quick, forceful breath through it. And boom! The little meter immediately shows whether their breathing power is strong enough to make that inhaler work properly. It just takes all the guesswork right out of the equation.
Okay, so beyond your breathing power, there's that second major factor we talked about, the medicine itself. And believe me, when it comes to inhaled medicine, size is everything. Where those little particles land in your lungs depends completely on how big they are.
This is actually pretty fascinating stuff. You see, the larger, fine particles, they tend to get deposited pretty early on in the main central airways. But to treat inflammation that's way down in the really small, deep airways, you need extra fine particles. These things are so tiny, they can just float all the way to the very edges of the lungs right where they're needed most. Okay, let's put all this theory into practice and see how it comes together in the real world. We're going to look at 3 different patient scenarios and see how a doctor would figure out the perfect match. So first up, we've got an older patient with COPD. They're a bit frail, and they have a hand tremor, which, as you can imagine, could make coordination pretty tough. Sure enough, the tests confirm it. Their breathing power is too low for a dry powder inhaler. That's out. And the hand tremor makes a standard PMDI risky. So, what's the logical choice?
Well, either a soft mist inhaler, which doesn't need a strong breath, or a PMDI paired up with a spacer, which totally removes the need for that perfect timing.
Okay, next up, a younger patient with asthma. But, and this is the crucial part, their condition seems to be located deep down in the small airways of the lungs.
Now this patient, they have strong lungs and great coordination, so they could probably use just about any device. But the key factor here is the location of their disease. To get that medicine all the way down to those deep airways, the absolute best choice is a device that produces those extra fine particles, like a specific type of PMDI or an SMI.
And for our last example, let's look at a patient who has a strong preference. They want a simple, one-step device, and they seem to have pretty powerful lungs.
The in-check test confirms it. Their breathing power is more than strong enough for any DPI. They can power the device reliably every time, and the simplicity of a breath-activated device just fits their lifestyle. So in this case, the DPI is a perfect match of both ability and preference.
So it all comes down to this simple 5-step process. First, screen abilities. Check that coordination and strength. Second, if a dry powder inhaler is on the table, you've got to measure the breathing power to be sure. Third, target the right part of the airway. Do you need medicine deep in the lungs? Fourth, and this is so important, always teach and check the technique. And finally, number 5, if the treatment just isn't working, remember to reassess the device itself. It might just be the missing piece of the puzzle.
You know, this all leads to one crucial question for you to think about. It's not just about taking your medicine, it's about making sure you're using the right tool for the job. Understanding these ideas really empowers you to have a much better, more informed conversation with your doctor and to make sure your inhaler is truly the perfect fit for your lungs.